We've been in contact with state officials over the last several days. We're very confident that Dr. Alexander Scott is prepared. Uh, we have to be very careful about this. The virus will probably spread. We've already had several incidents in Rhode Island. There's a possibility of more. But we have to be cool and calm about it. And I do think the state has taken very strong steps. And then nationally, our challenge is to provide the resources for the state for many items, such as testing kits, masks for medical personnel. So we're going back to Washington today and move an emergency supplemental appropriations bill to do that. What is somewhat disconcerting is that we're not as well prepared because the president has been taking apart our epidemic reaction squad at the National Security Council, as well as the key individual on the National Security Council who was responsible for these issues. So they're trying to catch up, unfortunately, rather than being ahead of the game.
Has he talked about restoring the funds that were taken from the CDC?
That will be probably a part of our appropriations bill. As you know, just a few weeks ago, he released his budget at the time that the epidemic was apparent in China, and he took up to $4 million from CDC and NIH, which, together with the cuts to the staff on the National Security Council, left us not in a very good position to coordinate and prepare for this. So they've been improvising, unfortunately, rather than executing a plan that was in place and well-funded.
Do these latest cases, deaths out on the West Coast, do these add urgency to all of this?
It does add urgency to this, and what else adds urgency is the projections by many public health officials that there will be a larger pool of people who are affected. Hopefully, we'll be able to treat them effectively. But the other factor, too, is that this is interrupting the global supply chains dramatically. And so we're seeing market effects. The market collapsed literally last week, the largest fall since the 2008 financial crisis. And that could continue forward as supply chains are disrupted.